Hey, this is Steve at Norfolk Physical Therapy Center, and I wanted to talk to you a little bit today about headaches. Years ago, I worked at a headache clinic, and we were able to do a lot to alleviate a lot of people's discomfort. Uh, Fact of the matter is, many people don't think about physical therapy when it comes to headaches, but often there are real issues that we can deal with. And a lot of them lead back to posture, as we've been talking about. Typically, you'd want to have your nice seated posture erect so that your head's actually on top of your shoulders and there's minimal stress on your muscles. But often what ends up happening is you're looking like this, you're slouched, so your head is way in front of your shoulders now, and if you relax it, it's in your lap. The average head weighs as much as a bowling ball, so those little tiny muscles at the base of your neck have to hold that bowling ball up all day. And hopefully you've done your basics at your workstation, your monitors in front of you so that you're not cocked to one side or the other constantly. Hopefully you're not on the phone like this, doing that, or you don't have glare so that you're squinting. And one thing that a lot of people forget about is ventilation. If you're sitting in a workspace and working and you've got a vent that's blowing cold air on your neck, I mean, you can be in an air-conditioned space, but I'm talking about where there's actually a draft or a breeze or a vent. That can cause problems on that side too, so just be aware of that. So, here's the genesis of those headaches. You have muscles at the base of your neck that are very small, some of them, and I'm indicating by my fingers the length of that muscle. So when you're nice and upright, you can see that muscle has a nice length to it. If your head is squinched forward, you can see that muscle's really shortened. So it's got to hold that shortened position for prolonged periods of time, which it does not like. And that can generate headache pain. Typically it starts at the back of your head, and then it may radiate around over your ear and even come up behind your eye. And we'll have people describe that specifically. It comes up to their forehead or it's behind their eye. These are very typical musculoskeletal headache reference zones. So if that's something you're having, first of all, you want to correct that posture. You can try and put a little pressure on it with your finger and stretch it, or you may need physical therapy, and that's something we do quite a bit of here for headaches. And if you need some help or know somebody who does, feel free to give us a call and maybe we can help you out. Good luck.